Report and straight to the SHA Question. Guest tonight, Gilbert Osoro, who is the Assistant Director Registration and Compliance under the umbrella of SHA. Thank you so much for creating time to be with us. Seeing a lot of questions as to this. Perhaps maybe there's not much knowledge out here as to really what SHA and SHIF is about in the country. Do you suppose there's a gap in that, and is there much that is being done to address the same?
First, thank you for TV47 for extending an invitation to the Social Health Authority to join your audience this evening. We don't take it for granted. And on the question that you've raised, SHA is working overdrive to demystify SHA. And my being here today is a testament that we are trying to reach out to Kenyans to empower them. Remember the good book, the Bible says, my people perish because of lack of knowledge. And at SHA, we've put into place a robust sensitization program to reach out to our members. So we are reaching out to our members through the social media platforms, through engagements, through TV. We are going where the people are, at the markets, churches, mosques, and we've also leveraged on technology by conducting online webinars. Yes. Okay,
and speaking of reaching out to everybody and the government's umbrella on ensuring that there's health mashinani, I realize that SHA has rolled out the county level initiative. We want to unpack that this evening, especially looking at the oncology package as well as the emergency package. Could you briefly explain to us, or to the viewer, just what SHA is and what of course exists in terms of the benefit, even as we look or narrow it down to that level?
Thank you, Linda. The benefit package is where the rubber meets the road. And I'm happy you've mentioned one of the highly patronized benefit package, which is the oncology benefit package. But before I do so, let me take Kenyans down memory lane by telling them the purpose why SHA was established. SHA was established to manage the social health insurance in this country. It replaces the defunct NHIF that for some years had been managing social health insurance but did not meet the aspirations of these Kenyans. Now, through the passage of the Social Health Insurance Fund Act, number 16 of 2023, it gave rise to 3 funds. The first fund being the primary healthcare that establishes a framework for management of healthcare services in level 2, level 3, these are health centers and dispensary, and select level 4. The second fund is the SHIF fund, the Social Health Insurance Fund, which replaced the defunct NHIF. This is a members' contribution club whereby members contribute an equivalent of 2.75% of their income. Thirdly, we have the Emergency Chronic Critical Illness Fund, and this was set up in realization of the 2010 Constitution, Article 43, Sub-Article 1A, that talks of every Kenyan has the right to the highest attainable standard of healthcare, including emergency treatment. Now, the commencement date for this SHIF Act was November 2023, with a 1-year transition period that ended last year on 21st November 2024. Now, the principles of SHA are: 1, pooling financial resources and risks. All Kenyans contribute to one basket. I want to put it in a layman language, that when a Kenyan is sick, the entire country contributes to ensure that the other person who is sick has financial risk protection. Number 2, everyone contributes the same proportion of their income, 2.75%. Number 3, they get a standardized benefit package, which is the SHA benefit package that has been expanded exponentially. Finally, reimbursement to healthcare facilities is standardized. And registration to SHA commenced on 1st July 2024 with a rollout date of 1st October. Now, to come back to the oncology benefit package. The oncology benefit package that is administered by SHA supports the full continuum of care. And when I talk about the full continuum of care, the entire treatment journey, from screening diagnosis, treatment to palliative care. The aim is to ensure financial risk protection to our member. Allow me to give the scope of cover for Kenyans to appreciate the length and depth of the oncology benefit package.
Hold it. So when you talk about the scope of cover, would that then involve just who qualifies for the oncology package? Will that highlight that?
Very important question. Who qualifies for the oncology benefit package? This must be fully paid up members of SHA. And when I say fully paid up members, I'm talking of members of good and regular standing who have remitted their contributions to date.
Okay.
Yeah.
And so access is pretty much easy, and in terms of the beneficiaries?
Yes, access is easy. Now, for members of SHA who have been diagnosed with cancer, now it starts at level 2, level 3, whereby there's initial screening, and they select level 4.
Okay.
They are sent to higher level facilities. Remember, under the new status, there's a clear pathway for referral from lower level facilities to higher level facilities where you can get specialized care and consultants. So for purposes of diagnostics and staging, this involves confirming the presence of cancer cells in the body.
Right.
And for purposes of treatment, they do some diagnostic imaging for purposes of treatment. Number 2, we are talking of treatment, and I did indicate it covers the entire continuum of care.
Okay.
When it comes to the oncology benefit package, 1, we have chemotherapy, medicine to kill the cancerous cells. Number 2, we are talking of radiotherapy, using radiation to kill the cancerous cells. The other option that currently is being administered by SHA is hormonal treatment, using hormones for purposes of treatment of cancer. And finally, we have immunotherapy, whereby you boost the immune system to fight cancer. Apart from that, SHA caters for laboratory investigations. We are talking for men, prostate-specific antigen, PSA. We are talking about women, mammography for cervical and breast cancer, among many others.
Okay.
Apart from that, SHA caters for oncosurgery, that is surgical procedures for purposes of oncology.
Yes, I'm sorry I'm cutting you short, because I also want to understand some critical things. And we have questions coming in. For instance, one would want to ask, how then does this come to reduce the financial package for persons with cancer? And above everything, are the services available across the country?
Thank you for that wonderful question. As I did indicate, SHA is your trusted caring partner.
Okay.
The cost of treatment of cancer is not cheap in this country. Without SHA, members would struggle to meet their expenses. As I've indicated, the limits of liabilities when we rolled out on 1st of October last year were set out at 400,000 shillings. But owing to the petitions that Kenyans put across and requested that the cost be reviewed, the government reviewed that particular cost, and on 1st April 2025 this year, the cost of cancer treatment, apart from the 400,000 that was in the oncology benefit package, the government provided for an additional 150,000.
Now brings it to 550,000.
550.
Is that really enough? Do you think that will be enough? And if not so, do we still have other plans to adjust the same?
Thank you for that good question. We appreciate, and we are hearing Kenyans, and the government has already pronounced itself. As we speak currently, the benefit package tariff advisory panel, which is the organ that is by law given the sole mandate to review the benefit package, is working overdrive to ensure that that particular package is enhanced so that it's able to meet the entire cost of treatment.
But until then, if there is a cancer patient who has exhausted the limit as it stands today, what happens?
Thank you. In event a cancer patient exhausts the limits of liability, I've indicated that there's a fallback position, a reprieve for them. They can fall to the emergency chronic critical illness fund, where they can get an additional 150. I also wanted to bring to your attention, after the review of the benefit package on 1st April, the cost of treatment, admission in critical care, and when I talk of critical care, I'm referring to HDU, ICU, was revised from 4,480 to 28,000 per day to a maximum of 12 days.
All right.
That is a reprieve because not many Kenyans can afford to pay the cost of ICU. The revision, in essence, is about 700%. So the government is listening, and I want to tell Kenyans, we will work together to ensure that you get financial risk protection, bearing in mind 1 million Kenyans fall into poverty because of exposure to financial hardships.
And there's a question here. Even as we talk about cancer treatment and the packages under SHA, are there coverage limits?
Yes, there are limits that have been set, but we've also provided for a fallback position, as I indicated.
So then, of course, they would rush to that.
Yes.
Okay, well, turning briefly into the question of emergency services under SHA before we come to a close, kindly explain to us what constitutes an emergency.
Thank you, very important. I want to tell Kenyans that SHA and the national government is in the process of launching the emergency evacuation benefit package. I did indicate when a reading of the Constitution, Article 43, Article 2, talks about every Kenyan having access to emergency treatment. The SHIF Act provides for Emergency Chronic Critical Illness Fund. And under that particular fund, any Kenyan who needs access to emergency treatment, what you're asking me, the conditions that require emergency treatment, including, number 1, heart conditions, that is cardiac arrest, stroke, maternity complications, and many others, can be able to access this. And the beauty with this benefit package, you can be evacuated from a scene of an accident or from a lower level facility to a higher level facility and get emergency treatment that is paid for by the national government. For people who are not members of SHA, because this is open to all Kenyans, they can be admitted to critical care for a period of 24 hours. Thereafter, they can opt to on board to SHA, and the SHA will continue catering for them.
All right, so what if a facility denies emergency services? What happens?
Now remember, the right to emergency treatment is a constitutional requirement. The contracts that SHA has signed with healthcare facilities, and we are talking in excess of 10,000 facilities for that matter, have a clause that indicates they must provide care in terms of emergency, and thereafter seek reimbursement from SHA.
And this would, these emergency services then would be accessed even at the remotest areas in the country?
Yes, the beauty with this emergency care benefit package provides for the establishment of a national ambulatory dispatch center that is based at the SHA headquarters. The function of this national ambulance dispatch center is to coordinate ambulances across the country. They complement the county governments in terms of emergency when there are mass disasters, accidents, amongst many others.
All right, before we come to a close, because you have touched on pretty critical matters that we had planned for this evening, what about the public access to SHA and all that, and especially the latest program coming on board for teachers? Because there's a question on that as we close.
Thank you. We have good news for Kenyans. From the 1st of December 2012, the teachers will be onboarded to the Public Officers Medical Scheme Fund, which is the comprehensive medical cover that is being administered by SHA. Now remember, last year, the government did pass the Public Officer Medical Scheme Fund after amending the Public Finance Management Act that provided for a fund to be established to offer comprehensive cover to civil servants. And they'll experience an enhanced cover that will be subsidized by the national government, and they'll forfeit the medical allowance they used to get.
Gilbert Osoro, I hope we can invite you some other time because I see we have lots of questions, but then again, time does not allow us to highlight or speak to all of them. Assistant Director, Registration and Compliance, SHA. It was great having you this evening to enlighten the Kenyans on some of these services that are available. It is now time for us to make sense out of